Welcome back to the Perinatal Podcast. This week I have with me Dr. Rachel Moore. She is a doctor of physical therapy and owner of Disrupt Physiotherapy, a North Houston-based out-of-network physical therapy practice. At Disrupt, Rachel and her crew focus on training #MomLife through functional fitness and strength-focused orthopedic and pelvic floor physical therapy. They work with women in all stages of motherhood, from preconception to prenatality to postpartum, for 5 weeks and 5 years. And their passion is helping women find their strength to live their lives leak-free, pain-free, and heaviness-free. Rachel also teaches with the Institute of Clinical Excellence, which is a continuing education company for other physical therapists in their pelvic division, where she gets to teach other PTs how to be a positive voice in the pelvic, prenatal, and postpartum space. Welcome, Dr. Moore.
Thanks for having me. Super excited to be here.
What a pleasure. Thank you so much. And I will be transparent with the listeners. I had such a snafu earlier, so I appreciate your patience. I started talking and I was like, I don't even know the words I'm saying. Let's start over. So
We do. It's Monday. Redos exist on Mondays.
I mean, it's funny because I post on Tuesday, so people can be like, huh? But yes, today is a Monday and I am feeling every bit of it.
Yes, me too. Same.
So I love to start out by asking people how we know each other. And when the answer is, I found you on Instagram and DM'd you, I say that. So you don't have to be like, I don't know you. So thank you for taking the opportunity to spend your time with me to share all of the things that we're going to discuss today.
Yeah, thanks for reaching out and messaging me. I love doing podcasts and just getting any opportunity to educate about pelvic floor and prenatal PT. So I'm super excited to be here.
Yes, absolutely. So now tell me, because I have a history, I've realized sometimes we start jumping in with some of my experts that come on, and I'm like, I'm wondering, sometimes people don't really know the kind of the basics. So what is a physical therapist?
So physical therapists, there can be a lot of kind of subsets of physical therapists. So essentially, we like to call ourselves within our own profession like movement specialists or movement experts. So there are orthopedic physical therapists, there are neurologic physical therapists, there are pelvic physical therapists. So depending on what kind of realm somebody specializes in, their goal is on restoring functional movement for whatever diagnoses. So in your orthopedic population, that tends to be like back pain, shoulder pain, neck pain, and your neuro population, that's like spinal cord injuries and strokes and getting you back to functioning there. And then in the pelvic space, a lot of times that's like prenatal and postpartum rehab and recovery and birth prep and things like that. So depending on kind of what little subspecialty somebody is in really dictates the types of patient populations they see. But for the most part, physical therapists are doctoral trained professionals. It's a clinical doctorate degree that has been the industry standard since 2020 was like the goal to transition every program to a doctorate degree. So anybody that's graduating since 2020, it's a clinical doctorate. People that have been practicing prior to that can take a transitional doctorate and have that doctorate degree. But yeah, and then lots of, after you graduate with your doctorate, kind of figuring out what population is your jams, and then taking continuing education within that population for however long you have your license and you're practicing.
I really appreciate you sharing that, because not to brag or anything, but I am deeply clumsy. So I have for a very long time spent a lot of hours with some physical therapists. And I actually remember when that was starting to ramp up, that people were talking about, I have a master's, but it's going to a doctoral. And so new people, and then kind of that transition that you were talking about, the transitional doctorate phase. So that's been really interesting, I'm sure, for the profession to see how all that's kind of shaken out.
Yeah, for sure. It's definitely interesting. There was a lot of some spicy feelings for a while of like new grads. They're like, well, I'm a doctorate, and people that are like, cool, but I have like 20 years of clinical experience. So like, let's talk. So it's cool to see now that that's kind of the standard, and people that are going to transition to a doctorate have transitioned to a doctorate. Great. It's not to say you have to have a doctorate degree to be a good physical therapist by any means, but yeah, that's definitely more of that standard.
Nice. Absolutely. And I just appreciate you sharing that too. It's so helpful for everybody to really understand kind of what that is and what it's not. And I think sometimes people might conflate that with occupational therapist or chiropractic or orthopedist, all of those things that kind of have some similarities, but then obviously certainly very much some differences.
Yeah, for sure. For sure. We love working with all of those people, but
Yes.
all kind of have their own like part of the team for sure.
Yes, yes, absolutely. Wonderful. And so what got you interested in working as a physical therapist?
So when I was in high school, actually, goes way back, my dad had a neck surgery and my brother, this is really cheesy. My brother was in a rock band in high school. He was like Katy famous. I grew up in Katy, so
Yes.
everybody knew who he was. And
Amazing.
was practicing with his band one day, and he had like his guitar and he was practicing. He had a huge amp, and his foot pedal was on top of his amp, and he spun around with his guitar, and the foot pedal flew off his amp and hit his kneecap and dislocated his kneecap and then ended up like tearing everything.
Oh my
And
gosh.
it's crazy because like people are like, "Oh, your brother had knee surgery. Was he an athlete?" I'm like, "No, he was just playing guitar." Like it was just a really crazy incident. But
That's
it was
wild.
wild, right? Yeah. And then I think the story goes that he put his kneecap back, but he went like the kneecap went around this way and then he just pushed it back the rest of the way instead of anyway. That's the story. I wasn't there. That's what I hear. It was crazy. He was
Wow.
18. And so he had a lot of feelings about having had this surgery, and like he suddenly lost all his freedoms and wasn't able to drive and couldn't go hang out with his friends and all these things. And when he started physical therapy, seeing his physical transformation for one, but also his like emotional transformation and mental transformation of being like kind of given this like freedom of movement again, really struck me. I never even went to a session with him, but I remember him talking about it. And he was so grateful. My dad was a chef. My dad cooked a huge meal for the PT clinic on his like graduation day of physical therapy. And they like catered it in and brought it in. So just getting to see that transformation, I was like, I knew I wanted to do something medical,
Yeah.
but I didn't know what route I wanted to go. Seeing that really was like, like maybe I'll look into this physical therapy thing. Like, this is pretty cool. And then my dad's actually a veteran, a disabled veteran. And so he's had some stuff that's happened as a result of an injury that he had in the military. And so with all of that, I was like, well, maybe I want to do this PT thing, and maybe I want to work like in the military or for the military or like serve veterans in some way.
Mhm.
I was really fortunate. My dad he's a Texas veteran. So the Hazelwood Act covered my entire undergrad. So it paid for, he legacied it to me for me to be able to go to college. So I was always in my mind, like, this is how I'm going to give back and do all these things. And then that is clearly not the route I went, because now I work with pregnant women all day. But
Who
the
could also be
journey of like
veterans? You
this
never know.
therapy started. Right. Oh, for sure. 100%. But just kind of a funny how life just like takes you on pivots and takes you down different pathways for sure.
Absolutely. I'm going to have that kneecap circular vision in my brain for a little while for sure.
It's
Whether or not it actually
insane.
happened, it doesn't matter. It's still living here rent free.
Yeah, it's a thing of legends, you know. And my brother's like a really, really tall guy with like long hair. So it's probably like the most metal thing that you can
Of
imagine
course.
somebody doing is like, let me just shove my kneecap back. So he's
Oh
probably
my
gonna die when
gosh.
he listens to this and be like, why'd you tell that story? King
Hello,
of
brother.
legends.
I love the story too, where your dad's like, I'm a chef and I'm just gonna
Yeah,
send love through food to everybody
for
who.
sure.
That's wonderful. You know, a lot of people have that situation. A lot, not always, but a lot of people in mental health, for example, have had familial history of family health or their own individual. And that's what spurred them into getting a social work degree. Or for me, certainly everyone who has listened before, and certainly welcome to all of the new people this week who are here to hear Dr. Moore for the first time. I had my own perinatal issues with fertility and loss, and when I was deciding what I wanted to specialize in, when I went to private practice, that really is ultimately how I ended up going. And so it's interesting when you have these stories, whether or not they're legends of rock or not. Yeah, that's really very interesting for sure. So tell me about what got you started into deciding to start Disrupt.
Yeah. So I started my career, I guess, I would say really in undergrad, as a tech for a really busy PT clinic. And it was great because I learned a ton. I was maybe doing more than I should have been doing, but the people I worked with were fantastic. And I was just like, that really like set, like, I'm going to be a PT. This is it. This is what I want to do. But in that setting, you're seeing a lot of patients. It's like your traditional outpatient model for people that have maybe been to PT before, where you are maybe double booked with somebody, or there's another person coming in on the 15-minute mark behind you. And that's all I really knew. Like, I thought that that was just kind of the standard across the board. This is how outpatient therapy is. And so I went to PT school, kind of got exposed to some other stuff. And then when I graduated, right when I graduated, actually, my husband was laid off of his current position and was told, you can apply for a promotion across these like 7 cities, or you can find a new job. And so he applied for a promotion, and it led us to moving back to my hometown of Houston, where I never, ever, ever wanted to live again. But I'm really grateful that it did push us here, because it really kind of pushed me away from my safety net of options, because the plan was always for me to go work for the same company that I had teched for. And I was going to be a clinic director really quick. And there was all of these things that were going to happen. And it was kind of
a path and a trajectory all set up.
100%. Yeah. And I didn't even think to question it. I was like, well, yeah, like, this is great. I love it. So when we moved to Houston, I was able to kind of skirt that path, and then did a really brief stint in pediatrics, which was not my jams. Like, that's where I realized, like, I love children. I love my children. I don't love treating children, and that's okay. It's just not my jams. And so I ended up as a clinic director for the same company that I used to work for up in the Dallas-Fort Worth area, at a clinic that I was commuting to. And I loved it at first. I was super passionate about it. I was a relatively new grad. I was really excited about the opportunity to be able to grow this clinic and grow this practice. And I was doing marketing and going out and meeting with people. And it was very corporate. And so at the end of the day, it was like certain metrics that you have to check the box. And if the box isn't checked just so, even though we think you're doing great, you're not quite what we're expecting, or you didn't do a good enough. And I'm very much a people pleaser. And so that hurt. Like, that was hard. I felt like I was doing all this stuff, and growing. And I wanted these, like, hey, like, this is how we can see that you're doing well. And because the clinic itself was still not profitable as a solo PT clinic, I wasn't getting that. And so that was really tough for me. And then I kind of started the wheels turning of like, well, if I can grow this practice as much as I've grown it for somebody else, like, clearly I have the skills to be able to grow something. Maybe I should do this on my own. And I had kind of this like dance with the owner of the gym at the time that I work out out of, like, I really don't like what I'm doing, and I kind of want to open my own thing. And he was like, well, where do you want to open it? And I was like, I don't really know. And it was like back and forth of like, do you want to open it here? And I was like, maybe I do. And so it ended up just really kind of organically coming up that I could put my table in the corner of the office and treat patients there. So that's kind of the original start. Continued working at the clinic that I was at for probably another 4 or 5 months. And then actually I was getting pregnant with my daughter, who's now 3. That was the final push of like, I'm commuting to and from work. I'm working, I'm treating 40 hours a week, and I'm marketing outside of that. I don't have time to also have a baby. Like, how am I going to do this? I'm going to be away from her a ton. And so it was that lifestyle kick of like, is this really what I want? That kind of made me take a step back, and decided to just go all in on Disrupt. So I put in my notice in October of 2019. And then I trained at a hospital system for a PRN job. My plan was to do PRN for a little bit with the hospital systems while I grew Disrupt. So in December and January, I trained at this hospital system for 2 months. And then I had my daughter. My water broke a month early, February 4th.
Wow.
I had her, and then everything shut down in March with COVID.
I was going to say, I know exactly where you're going when you said 2019. Yes.
It was wild.
Yes.
But it was honestly great, because I felt no pressure to go back or to go see patients with a newborn at home, like when all of the things were crazy. So I was able to stay home. I started seeing patients like virtually, and I started having people come to my garage. I would stand in my garage and they would stand in my driveway, so that we were separated, and we would do our PT sessions.
Yes.
That was really kind of how it grew. It was cool. It was great. Honestly, it was a weird time. Like, I think we all can agree it was just a weird time. but it was kind of cool. It was like really tested my creativity right out the gate for sure. And then, yeah, once things reopened and life started kind of picking back to normal, it just took off from there. And so I had a room. I graduated from the table in the corner to a specific room that had a door, which was super exciting. And then from there, I ended up subleasing a second office space. And then now that second office is a full blown office. It's not a sublease anymore. It's like 3 rooms. We like quadrupled our square footage. So it's grown a ton since 2020, which is awesome.
Wow.
Yeah.
That's amazing. The idea that you were talking about working with children is so funny because when I was in grad school, there was one of my field placements was in a psychiatric hospital and there was a child program and I was like,
Whew.
absolutely not. I will not.
Yeah.
Keep me away from them. I actually went down one day because I was like, okay, I have to overcome my fear for a day. But long story, I mean, so then my first job I was supposed to do something else. And then they put me on pediatric inpatient. And I was like, this is the opposite of what I thought I was supposed to be doing. I was supposed to be doing outpatient adult. But all that the long story to come to now, I teach a class at the University of Kansas and it's a summer elective. And then I'm like, so why would you take suicidal ideation and self-interest behavior? And some people literally have been like, because the other option was children. And
Wow.
no.
Crazy.
I was like, that's significant that you really
Yeah.
don't have interest in suicidal ideation and population, which I mean, crisis is every population. But anyway,
Right.
it's so funny how some of us are just like, absolutely not. And I used to work with children when I had an in-person private practice, but now I don't like doing that over virtual.
Oh,
So
it's hard. I can't imagine over virtual. Holy cow. Yeah.
yeah,
It's
yeah.
funny. We added pediatrics to Disrupt now. So we do see kiddos. I
Amazing.
don't see kiddos. I
You
love
don't.
the kiddos. I hold the babies. I will
Yes.
hold my patients' kids all day long. I will play with my patients' kids. I
Yes.
love it, but I
Yes.
don't like treat them. Like I
Such a
want to
different
play
thing.
with them and
Yes.
snuggle them. And that's it. So
Those are two wildly different considerations. Treating
yes.
somebody versus being like, yes, of course, I'd be happy to watch your kids so you can go
Mhm.
do your reps and whatever else you need to
Yeah.
be doing. Yeah.
Very
That's so
different.
funny. Just when you said that, I was like, gosh, if I had $1, I wouldn't have a
For
lot of
how
dollars,
often?
but yeah, it's
Be
funny when
great.
people are just like, no.
That's so
And that's
funny.
funny too, because yeah, I mean, so many people, I mean, we left Houston to move here to the Kansas City area on St. Patrick's Day of 2020 as well. So, I mean, it
Oh,
has been,
wow.
I was going to start a private practice up here. And of course, then I had to stay home with my then 8-month-old son because we didn't know
Mhm.
anybody. And so it's interesting to see how much the world has changed a lot. We weren't going to talk about COVID, it's not part of our outline, but just to see the ways that even in the PT space that people were able to continue on serving,
Mhm.
even so far as like I'm in my garage and you're outside, so we're technically not sharing oxygen and we're far enough away, but I'm still able to help you to get your goals accomplished and doing virtual things certainly as well. That's really an inspiring story. And now look, you're growing and growing.
Yeah, it's been great. It's been really, really, it's wild. I agree to look back and see like all the ways you had to pivot. And it was like, if you didn't pivot, then what? Like there's no option but to pivot, really. You kind of just had to.
Yeah,
So
well, and I love what you're talking about too. Now, I do these days take insurance, and we could go on a really long. We could have just a conversation about insurance and the way how horrible
ugh.
it pays and why people don't. That's not the purpose of this conversation today, but one
Another
day I will
episode.
get on my soapbox and it will be a full 60 minutes or more. But I really love what you're describing. I've had a medical doctor on before who does the same thing where they're no longer beholden to the insurance demands, and so they're able to really provide the quality care that's so specific to that patient's needs and at the same time is not requiring to check some random box or be shortened or whatever that might look like. I don't really have a question for you. I just wanted to like validate and praise like how wonderful that is at Disrupt, where you're able to just like, this is what I need. And you're all like, great, let's go.
Yeah, it's been awesome. It's been freeing for sure. I mean, it's wild when you're not in the medical space. You don't really understand how much insurance dictates everything, like how many
Everything.
visits you have, what the timeline on those visits are. So like, say
Mm.
you get 12 visits, but you have to use them in 4 weeks. Like now you're coming 3 times a week. I don't need to see you 3 times a week. Like I don't want to babysit you doing your
Yes.
exercises. I want
Yes.
to teach you and empower you. And then you go off and do, and then you come
Yes.
back to me and then we progress. Like that
Yes.
is such a better model. And it's been really interesting because in the cash-based space, I won't go off on too long of a tangent, I promise.
I mean,
Uh,
well, I'm going to have you on one day and we're just going to talk about that.
yes, seriously. But
I'm
it's
so
really
passionate
nice
about it.
because when you get like, there's a vested interest in everybody that we see. Like if they were just checking a box to go to PT because their doctor said to, then they don't typically end up in our clinic. And that's fine. Like if that's the route that somebody wants to go, like I would argue you're probably not going to have great outcomes. But if that's your route that you want to go, then go that route by all means. It's been so nice to get the people in our doors that are like, I want to feel better. I want to feel stronger. I want to feel empowered. And I'm willing to do the things to do that. Like I'm going to put in the work in between the sessions and all of the things. So it's been awesome. And it's been great. I've hired 2 PTs since I started Disrupt, and being able to give that gift to them of like, hey, you can practice this way. And they're like, what?
Go
This is
forth and
wild.
do the best PT work that you know how to do, not based on anything else.
Yeah,
Yeah, and I know we sit in a place of privilege to be able to afford to not use insurance in certain
for
spaces.
sure.
It's very difficult. It's not, there is, as I would say, at least once an episode and many times a day with clients and in life, like very rarely is any one thing all one thing. And so for us to be able to say that, it would be nice if insurance could, it's like they somehow have forgotten how to practice or something. And so then they set these really rigid and out of touch policies that
Yeah, for
do
sure.
not empower patient outcomes the best that they could be based on, like you said, 12 sessions, but within 4 weeks. Or in my case, it's if you need to do a 60-minute session that's being billed through insurance, you really need to make sure your documentation clarifies why you went over 45 minutes, or technically 53. And so anyway, it's just really nice to see that you all are able to practice in that space so that you can, like you said, the internal motivation that comes from, or that can help lead to practicing outside. You know, my little joke that I make is, you know, if you go to the gym 45 minutes a week, you're not going to look like Heidi Klum, right?
Yes,
The same
I
as like
love that.
if you show up to therapy 45 minutes a week, like, yes, we are going to get some stuff done. Well, aha moments happen, insights increase, lots of things can happen in 45 minutes. And if you're doing absolutely nothing outside of those 45 minutes, your outcomes are not going to be as good. So
Yeah.
it's nice to hear that you're saying like you're recognizing people who have that vested interest as well and who are able to show up. And again, I should clarify, not to say that people who use insurance don't, but
Right. Yeah,
what you've seen, you know, historically.
for sure. 100%.
Yeah, absolutely. And so tell me some about the biggest misconceptions about physical therapy. What are people like, oh, physical therapy? Like, what are people seeing in movies, perhaps, that's not right?
Grey's Anatomy. I feel like Grey's Anatomy is terrible.
Oh my gosh,
so
I haven't seen that since like 2007. What
oh,
are
I
some
don't know how it's
examples?
still on. It's wild to me. They've got to be on like their 37th season.
It's wild. Yeah. Hey, make your coin, team. Make your coin.
I think one of the biggest misconceptions is that physical therapy is like a one size fits all approach. So I get asked all the time, like, my back hurts. What 3 things do I need to do? Like, well, I don't know. Like, how are you sleeping? How are you eating? What's your stress like? Like, what movements bother it? Is it when you lean forward? Is it when you lean backwards? Is it when you sit? Is it when you stand? Is it right away? Or is it after you've been standing for 45 minutes? Like, there are so many things that we need to kind of dive into for an individual person. And I feel like I have a beef with like a lot of like pre-structured programs, particularly when we talk about like the prenatal and postpartum side of things, of like prenatal workouts or prenatal rehab or postpartum rehab. And it's like, there's so much individuality to every single human that to just prescribe across the board one thing or one intervention or one exercise misses the boat a lot. And so I think that that's a big misconception. I know this is going to sound terrible and like I'm bashing my own profession. And honestly, I kind of am bashing my own profession. All physical therapists are not the same. So like,
okay,
the therapist
that could be said of therapists.
Yeah, right. And just like every profession, right? Like there are people that just don't deliver as well in every profession. And like, not to say like that I'm a better therapist than the person like across the street or whatever by any means, but I think that there's a right therapist for what everybody's looking for, right? Like if you're looking for a specific thing, knowing the therapist, interviewing the therapist, like calling the clinic and asking for their background, there's nothing wrong with that. Because while we all have to have like continuing education units to continue to like renew our license, the quality of those CEUs is vastly different.
Sure.
The way that people are getting those CEUs is vastly different. And so just because they're up to date doesn't mean they're truly up to date. So I'm really big on like, not like, we're huge at Disrupt about like practicing evidence-informed practice and making sure that like we know what the latest evidence says for things, especially because a lot of time we're advising things maybe that like isn't what the doctor said, because the doctor is going off of guidelines from like 50 years ago that have been shown to be outdated. So we are very big on like, well, like, let me show you the paper that backs this up, or like
Yes.
clinical reasoning that's based off of the paper that we get this from. And so not every place does that, because it is extra work and it is extra investment. And so that's a big thing, is like, I hear all the time people say like, I failed physical therapy. And I feel like,
Really?
yeah, like, oh, I went to physical therapy for 5 visits and my back still hurts, or they didn't get my back better. And so like it failed, like
Oh,
physical
okay. I see.
failed.
Yeah.
But really like the physical therapist failed that person by not giving them the quality of care that they deserved. Realistically, they probably could have gotten better had they seen somebody different. You know what I mean?
I hear what you're saying.
So that's a big thing. And then
But
I
I
think,
like what you're saying. It goes back to that conversation we were having. Like when you're not beholden to the insurance company. And again, I do want to clarify, like, knock on wood, I've never had a 60-minute session rejected because I document like why we talked so long. And
right.
that's the thing, right? If you're able to be specific and tailor it to a person and they feel like they're being heard. I mean, listen to that. You said my back hurts and you asked six questions. Or like,
Yeah.
just, it's making sure that you're having that conversation in a meaningful way. When you're starting to meet somebody and you're building a treatment plan with them, and in your situation you're able to do that in such a freeing way that's very specific and measured, and so being able to say, you know, this is why we do this and this is why we do that. Also sounds like you're doing a good job of educating people on the why behind it as well. Like if you do this movement, it's going to help with this sort of thing, and which will help you with how much you stand at work. Or I think as humans, we enjoy understanding the why and the rationale behind things, which makes us feel sometimes more motivated to participate in it.
100%. Yeah, for sure. And like, I think, yeah, you get more intrinsically motivated, and I think it's empowering. And like that, at the end of the day, that's my goal, is like, whether it's you're empowered through knowledge, or you're empowered through feeling better, or you're empowered through your birth, like whatever it is, I want every person that like encounters disrupt to feeling empowered. Like that is my be all end all goal at the end of the day. And so I think just giving people that background and like trusting them to understand what it is that you're saying. Like it's not a waste of time to take that extra step to explain things to somebody, for sure.
Yeah. Oh gosh, I really appreciate you sharing that, because it's so interesting. I have one of my very best friends, my undergrad roommate, is an occupational therapist, and she used to
Cool.
teach even. And so I remember she was in grad school. No, she'd already graduated when we had lived together. I was in grad school, but she was teaching, and I remembered some of the classes that she was teaching and describing to me, because I'm ignorant certainly on some of the differences and the things that go on there. And our very good friend, while we lived together, one of our neighbors, her husband was a chiropractor, and so we would talk about the differences there. And like you said, it's can be part of a treatment team, and different goals and different things that are happening. But it's nice when we're educated and we know what we need, what we're looking for, what might help, what our goals are, and how to have somebody who's educating and helping you to feel empowered to understand how to take control of wherever you're going with that.
Yeah, absolutely. 100%.
Yeah. So tell me about perinatal physical therapy, pelvic health. Tell me how, I was gonna say, kind of how you got and how you decided to specialize in that, why it's so important.
Yeah. So I really ended up specializing in it again because of my daughter. She was my catalyst for a lot of things.
Yep.
I do, yes, like that life change, like, let's just change everything.
Absolutely.
I do CrossFit. And so I was pregnant with her, and I didn't really know what to do as far as like what was allowed and what wasn't allowed. And the people that I was seeing like as birth providers really didn't know much either, because there wasn't like specific guidelines, and like it was like, well, listen to your body. And so, but I was like, what does that mean? Like, what am I listening for? What am I looking for? But nobody could really tell me. And so that kind of kickstarted my journey into looking into things. And I will say, like, that was 4 years ago-ish. There's so much more information already now than there was 4 years ago,
Oh
like
my gosh.
wildly different, which is great. But also a lot of information doesn't necessarily mean it's all quality information. And a lot of that information conflicts. And so that kind of going down that path is what led me into like, well, I'm pregnant. I want to work out. How do I work out while pregnant? I'm going to learn everything I can about that. Well, now I'm postpartum and I need to learn how to get back into it. I want to learn everything I can about that. And it naturally just kind of segued into pelvic health because I was already seeing people and I was like, well, I might as well just be able to do everything and like talk to them about their pain with sex and their getting back into CrossFit. Like we just bridge all of the gaps and talk about everything because it's all related or can be all related. And so that's kind of what led me into that space. And it's crazy kind of going back to the amount of information and the quality of information that's out there. It's so varied. I think social media has been fantastic for giving a platform for a lot of education. And it's been fantastic to put the word of pelvic floor physical therapy out there. But again, like there's a lot of voices in this space and it's hard to know which voices you should listen to and like which ones are credentialed and which ones aren't and what are their credentials and like have they just had a baby and that's where they're coming from or do they have extra training? And so I think that's why pelvic floor physical therapist and like trained pelvic floor physical therapists, especially in like the exercise realm, people that are like really good at understanding exercise and getting back into exercise and things like that is so important because there's a lot of fear-based messaging out there. I remember both kiddos, but most recently, so the majority of the people I follow on my Instagram, I would say is kind of like echo chambery, right? Like I follow people that are kind of on the same page as me when it comes to like exercise and like empowering movement in pregnant women and empowering movement in postpartum women. And I remember most recently, my son is almost 8 months old. And when he was like a week old, I was on my Instagram and I counted one day, I had like 6 sponsored ads in like, I don't even know how long of scrolling, not very long of scrolling. They were all like, fix your belly separation or get rid of your mom body or like close your ab gap or like all of these like targeted programs that were, I was 2 weeks postpartum and I was feeling like maybe not the best about anything at that point, honestly. And now I'm being inundated when I'm trying to just get a break by all of these messages about like, look better, do all these things. And so I think having voices in the perinatal space that are empowering voices, that are evidence-informed voices, is so incredibly important. Like not just in social media, but also obviously in like actual visits.
Yes.
Yeah. I mean, yeah, I could talk about that for hours.
Well, but it's so interesting because I talk about like the TikTok of mental health, right? And so some of it is amazing because we are decreasing the stigma. We are making things more accessible. Don't get me on my soapbox about like, I'm not going to mention a specific, but like a lot of podcasts I listen to are sponsored by mental health services that are abusive, quite frankly, to the therapists who work for them. I, again, could do a whole podcast on that. And so one of those things where it's like, you're happy to hear that people are normalizing getting help and your favorite podcasters are talking about their own therapy and everything. We're also throwing a bunch of information out there. We're not really sure as to how valid it might be, the quality, like you mentioned. And so, and then also too, absolutely the targeting ads of like, fix your stomach and you're 2 weeks postpartum. And as though there's anything, I mean, certainly, oh, I'm going to get it wrong. What happens when your abs split in pregnancy?
Diastasis.
Thank you. I was like, I'm not going to say diastasis, right? And I'm not going to.
It's okay. It's okay. Everybody says the same thing. Don't worry.
Yeah. I was going to say diastasis. So I wasn't too far off, but still. But so it's not a bad thing for you to be aware of those things. And then we also have to be intentional about discerning what maybe makes sense and what we're not really sure. And then by, finding a doctor more to be able to ask questions and get appropriate information. So it really is a mixed bag of awareness and validity and all of that. But then also, is this correct? Is this healthy, helpful? We're not sure.
Yeah. I think it's going to be interesting. Like, I feel like our like the current time we're in right now and like how many social media apps there are and how many ways there are to access all of the things is just so unprecedented to see how it shakes out with everything, honestly. Because yeah, I feel like it's empowering people to ask questions of their healthcare providers, which I love. Like, I definitely think like, I can't tell you how many people I've had come into my clinic that are like, I came in, I asked my doctor for a referral to PT because I learned about it on Instagram and they told me no, or they told me I didn't need to go to PT. And like, but then they're like, but I pee my pants every time I sneeze. Like, how is that not a reason to go to physical therapy? And now they know that it's not normal. And so it's great. But yeah, it's interesting for sure. And I think that's another big kind of misconception or thing in the pelvic space, or reason why we need to be in the pelvic space is this idea that the things that happen postpartum, or maybe the issues people deal with postpartum, are like almost like you had a baby, so you just have to deal with that. Or like, it's almost this weird, like it's your retribution or way that you pay penance for having had a baby, or some type of like, it's just weird that we normalize the fact that somebody peeing all over themselves as an adult is normal, when in reality, there's so much we could do. Like if a guy was peeing all over himself every time he sneezed, people would probably be talking about that as like unhealthy. But because somebody's had a vaginal delivery, or maybe not had a vaginal delivery, it's been pregnant and had a cesarean delivery, when they sneeze and they pee, like, oh, well, you had a baby, so it's fine. It's crazy. And so educating people that that's not normal. I still remember sitting in the car with my mom and her sneezing and peeing and leaking. And like, she would always joke and be like, oh, this is your fault. Like, it's your fault. I have to cross my legs when I sneeze. Ha ha ha. And even still, like, she makes jokes about it. And I'm like, you can get help. Like, you can't blame this on me anymore. I'm 32 years old. Like, you have to take over for this. But like,
but think about it. Like, as soon as you said that, I'm like the Brooke Burke Poise commercials, because I remember I used to be into Dancing with the Stars like right out of undergrad, and she was on one of those seasons, and then she started doing those commercials with like, and not that there's anything wrong with like, thank you for having pads and inserts that help push the. But I'm like, but what else are we doing to? It's funny, like I really didn't put two and two together until you just said that. Like I see that as like, oof, that doesn't look like fun.
Yeah.
Instead of, not that it's Poise's job to be like, and let's call us over to be referred to your local physical therapist. But
like, poor PTs are always commenting on their social, like, don't forget to come see us too.
It's so
right. Normalized.
Yes, no, I just want to be very clear. Poise is not a sponsor of this podcast, but also shade to Poise. It is, yes, and I'm glad that there are therapists the PTs out there who are being like, hey, by the way, if you need these, you might also need this.
Exactly.
Yes.
It's crazy. Like, and even, I mean, I keep reference, I'm just going to talk about my entire family at this point. Like my grandmother had to have like a surgery for like a bladder sling, and then all the things that came out about the mesh and like how terrible the mesh was. And it's entire generations of women that have all these problems, that's like obstetric or gynecologic or like whatever issues, and that is all like linked to childbirth. And now finally, like with this shift in like prioritizing women's health that's been happening, I feel like over just the course of like the last several years, we're seeing people like kind of like stand up and say like, but like, maybe I don't have to pee my pants anymore. Like, there's got to be a way to fix that. And so, yeah, I think it's so important for that message to get out there. And what's wild, and it's crazy how many providers are still telling people, like in pregnancy, if you're peeing your pants when you sneeze, like, oh, it's just because the baby's there and it'll stop when you have the baby. But that's not necessarily the case. I've had patients that will come see me like at 14 weeks that are already leaking when they sneeze. Like, the baby is not that big at that point. And by the time they're 34 weeks, they're not peeing their pants anymore because they've addressed their pelvic floor dysfunction, and the other things that led to that pelvic floor dysfunction had nothing to do with the size of the baby. It was all completely related to their pelvic floor. So it's crazy how many, like, there's a lot of good work that's being done to spread this message of like, common doesn't mean normal kind of a situation, but there's still so much more work that needs to be done and so much more awareness that needs to be spread.
I love that. Common doesn't mean normal. And I'm really going to have to fight myself to not name this episode. Maybe I don't have to pee my pants anymore.
I love it. Let's do it.
Wow. I asked you to come on this show and I like didn't even know I do this for a living on the mental health side. So I talk about peeing your pants and sneezing and all of those things. And even, yeah, I'm just having so many epiphanies right now.
Yay. I love it.
So yeah, common doesn't mean normal, doesn't mean healthy, doesn't mean has to be.
Yep,
Can
exactly.
be changed through something else. And in this case, physical therapy.
And like really relatively, I don't want to say like easy, but like with the right approach is not something that is like a major thing, right? Like you don't have to go have surgery. You don't have to
Right.
get injections. Like let's try to correct the imbalances that are happening like from a musculoskeletal standpoint and see what happens. And in most cases, that's the answer. So yeah, it's honestly the most fun. I love what I do. Like I'm clearly biased because it's what I do, but
Yeah.
I just think it's such a gift to be able to work with people and like have those epiphanies. I mean, we have epiphanies literally every session of somebody being like, wow, I did not know that, or nobody ever
Mhm.
told me that. Why don't people teach this to 13-year-old girls? Like, I don't know. We need to change it.
Well, I was gonna say I have a very long, I've had multiple conversations and could get on another. I mean, we have so many new episodes we could possibly keep talking about, and I would
We need
need
to
an
make a
educator
list.
to come on, right? Like Spanish should be compulsory in kindergarten in the United States, and then we learn a foreign language in high school. Anyway, but don't get me started. But that's right. Like the things that we don't like, we learn what a vagina looks like and what pads are, and here's some pads and some deodorant and go on your merry way. But we don't talk about fertility cycles and ovulation testing and making sure that you feel empowered and educated when you start becoming sexually active. I'm the most like sexpositive.com over here.
Uh-huh.
Do I feel like our young people are confident to know how to use their body parts with each other in a safe and meaningful way? Absolutely not. And I certainly don't believe in abstinence only education. Not, right, again, soapbox today. Sorry for
Uh-huh.
that. But they're not, like, they don't know. We never had any sort of conversation about that. Anatomy and physiology, if it could be some sort of part of another class, is like PE or something. I don't know. I'm trying to rework education. I have no education
Right.
credentials.
How do we change this?
How do we, it's the same with mental health. Like if we were taught on the opposite side of that, I recently posted something like, what if we were taught as much about our mental health as we were about our bodies in school? So
Yeah.
there's me arguing the other side of it, like, look how much we are taught about our bodies, and also not in the most meaningful ways. And even so, outside of the perinatal scope, like it's so wild to me, I have some bursitis in my shoulder blade, and I had actually a massage therapist start massaging my armpit. And when she was doing that, she's like, well, this is connected to that. And when you do that, and she goes, see, I'm in a point right here. And she touched in my armpit, and like I could feel it in my
Refer over.
bursitis. And I was like, those are connected? What?
Uh-huh.
And so we walk around with these pains and this leaking or whatever it might be. And it's like, do my hips hurt because of my lower back, or is my lower back hurt because of my hips? And how is it? What is it? How is it all connected? So it's nice to know that there are people that we can go to, and you can ask the 17 questions that go with my one complaint that help you to
Uh-huh.
pinpoint, oh, this is what we need to do. Don't just do what you saw on TikTok. Come over here and
Yes.
we'll put a comprehensive plan together.
Exactly. Yeah. Let's custom tailor this like the tiniest bit.
Yes, I apologize for my education soapbox, but I felt like it needed to be said. So, but I really do appreciate that because, like I said, I've had so many aha moments in our discussion today where it's just like, oh, you don't just have to accept that as it is what it is. Sorry about your bad luck. Things
Mhm.
can be done.
Yeah.
And that's so empowering. Um, wow, amazing. So understanding that everyone has a unique journey, everyone's body is so different, everyone's situations. What are some common themes that you have noticed in your work?
So I would say the biggest common themes is that women are under fueling very often.
Okay.
They don't realize either intentionally or not, like either terrible diet culture, another episode,
Yes,
of
yes.
like caloric restriction, all the things, or they're just so caught up in like mom life that they don't have time to sit down and eat a meal. And they don't realize that they're like 2 bites of a peanut butter jelly sandwich and like one chicken nugget at lunch really isn't enough fuel. And especially if you layer in like breastfeeding on top of that, there's even more caloric demand. And then if you're trying to start exercising, then that's even more caloric demand. And so I see a lot across the board. People are under fueling, particularly under eating protein. And we don't dive into specifics of nutrition. Like I'm not going to give somebody a meal plan or like macros to hit, but our body needs fuel to prioritize things like healing. So if we are under fueling, we're not going to have the optimal recovery from anything that we need, whether it's like recovery from the workout that you did or recovery from the cesarean or the vaginal delivery or whatever it is. We need fuel. Like we need to be eating. We need to hydrate. We need to make sure we're drinking enough. The other thing that I see a lot is people in the physical therapy world are often underloaded. So they think like, oh, well, I'm going to take my like 3-pound weights and do my whatever. I'm going to do my like baby squat to this bench that's really high, but then that doesn't translate over into the demands that they have in real life. And so we talk a lot about like parenting is an athletic endeavor. Like you have to have some level of fitness. Like, and I call on like, say everybody's like an athlete, right? Like I think if you're a parent, you're an athlete. Like my toddler is more exhausting than any other workout I have ever done because she's nonstop. And she's 20, however many hours a day that we're just constantly keeping up with her. And so I'm really big on making sure that the training that you're doing, quote unquote, whether it's in your workouts or whether it's in your rehab or whatever, matches the demand of what you're trying to do. So if your car seat with your baby in it weighs 35 pounds, I need to know that you can lift more than 35 pounds multiple times because you're going to be lifting that car seat up and down.
Put it in, go to Target, pick it up, put it into the cart. Get it out of the cart, pick it up, carry it to the car, put it back in the car, drive home, or to the 17 other stops you'll have to make.
Exactly.
How many times are you picking it up? Even in just that one, I mentioned 6 in that one trip that we just took.
That one trip, right? Yeah. It's wild. And like that, if we have that strength capacity, then it doesn't matter, right? Like I can do that 700 times a day because I know that I can lift 200 pounds for 5 reps and it's a piece of cake. So my 35-pound child in their car seat is not a big deal at all. So it's a concept that the company, some of the people in the company I teach with kind of coined is called 1 rep max living, where if you're never training us, like you're never training to the stimulus to get stronger, right? Then when you do something hard or heavy or whatever, you are essentially exceeding your 1 rep max capability. So if I never pick anything up and the heaviest thing I pick up is my baby in the car seat, and then I do it 15 times on my 3 errands, I've greatly exceeded the capacity that my body has. And it's no wonder that like my back might hurt or I might feel like heaviness in my pelvic floor. But if I've done the things to build my capacity by getting stronger, then that 17 times doesn't matter. Like that was so inconsequential. It's like 15% of what I can do, quote unquote, my reserve. I'm not 1 rep max living where the heaviest thing I'm doing is so incredibly hard because the heaviest things I do is way heavier than my daily life activities. So we take that principle. They actually originated in the geriatric space because it's another population that's really frequently underloaded. That we take that concept and apply it to our prenatal and our postpartum patients because they need to have that ability to do the things and lift the things and carry the things because they're doing that all day long.
Yes. I just really want to, every person who is listening or watching or both, whatever, like validating that parenting is an athletic endeavor. You all
so hard.
We are athletes.
All of us.
Whether or not you want to accept that label, that is up to you. But I just want to send that love your way because it's so dang true. And it's right. And you kind of think of it like, oh, your baby is 6, 7, 8, 9, 10 pounds when they're born. Obviously there's a myriad and less and more. And you're like, I could pick up as an 8-pound baby, right? But then you recognize like that grows, how much does the car seat weigh, pulling the stroller out or the wagon or whatever that might be, and all of the things that go with it. And I'm so soapboxy today and I'm acknowledging it. We in the United States do not do a good job. It's the same as like we only have one postpartum appointment at 6 weeks. Like we don't do a good job of having these conversations, not to jump on the insurance conversation again, but often like we're churning and burning through clients and patients and trying to get people in and out. And it's so important for us to have those opportunities to really take a step back and think like, what am I doing with my body so that I can be as such a good source to take care of my own children, not even as like a watch me be the healthiest teacher in the world, but like physically capable of being able to play with and pick up and do the things with your child that you want to be able to do as long as you can. I like this underloaded idea. I hadn't thought about that either. Again, I don't specialize in anything physical. But we are athletes team.
Athletes.
So
We're all
we
athletes.
need to pay attention to how we are servicing our bodies so that we can then, of course, be available for our children who run us ragged. Beautifully so.
Beautifully so, in all of the best possible ways.
Yes. Amazing. Oh my gosh. I'm gonna bother you later because I think we've got like 5 other topics.
Yes, let's do it. I love it.
Some of them we might need another expert who might be a little more educated on the topic, like education, than we are. But some of the other ones I think we could really have a good, deep, and meaningful discussion on. So thank you, Dr. Moore, so much for the time, for coming on. What a gift, what a pleasure it's been. My brain has exploded like 4 or 5 times in this
Yay,
conversation
good.
so beautifully. So where can everybody find you?
So I'm on Instagram at Disrupt Physiotherapy. Follow because I post often. Okay, I used to post really cheesy, funny reels. Now they've just been more like, how does this movement translate into mom life, which is great. But the cheesy, funny reels pop out every now and then.
I love them all, which is obviously
Yes,
how I stopped you
all
on
of them.
Instagram.
Yes. And then our website is disruptphysio.com.
Okay, perfect. Well, thank you again for the time. What a pleasure it has been. And for everyone else out there, be curious, not judgmental. Goodbye.